So Charlie, can you talk to us a little bit about vaccines? I hear there's some news on yellow fever at the moment.
Yeah, absolutely. There's some positive and some negative news. Certainly there's an outbreak going on in central parts of Africa of yellow fever, which is really not good news at all. On the positive side, the World Health Organization and all the other relevant authorities have said since mid-July that anyone who's had a yellow fever vaccine doesn't need another one. So in the past, you needed an update every 10 years. Now, whichever one you had, however many years ago, is valid for the rest of your life. So that's great news, and it saves people money and saves people hassle. Now, the thing about yellow fever, it's a viral infection carried by a mosquito. So in that sense, it's similar in its transmission to Zika virus. And it's very common in certain parts of Africa, above South Africa and below sub-Saharan Africa, so in sort of middle zones of Africa. And it's also common in parts of South America from sort of Brazil downwards. Now, what's interesting, yellow fever doesn't yet exist in India, and India has a mosquito that could carry it. So all of our aims are to try and prevent yellow fever getting into India, which is why if you go to India from an African country, you're often required to show evidence of a yellow fever certificate. The other vaccine news that's up to date is that there's a shortage of hepatitis A, so people just need to be aware about that. Hepatitis A is the transmission of a virus, usually from dirty food or dirty water, and it causes jaundice, which means you go yellow, so in a sense similar to what happens with yellow fever, but it's very transmissible, so once someone's got it, they can pass it on to people they're living with as well.
Okay, and you mentioned briefly Zika, if we can go back to that.
Yeah.
What do you think is the threat there, especially with it moving into places like North America?
Yeah, it's interesting. Zika is very similar in a way to another virus called dengue, which is transmitted by a similar mosquito. And dengue is rising everywhere there's an urban population. So that's probably what's going to happen with Zika. So everywhere there's an increased urbanization, there'll be increased amounts of Zika. Now, unfortunately, for some people who get the Zika virus, for a lot of people it's very mild disease, fever, headaches, muscle aches, and it's over and done with. But for some people it does leave a residual effect, which is usually on the nervous system. Now, that could be anything from a mild paralysis of the face to a complete paralysis of the body. Fortunately, it's a very small percentage of people. The other more worrying thing is for women, and especially if you're pregnant, because it seems that the Zika virus leads to that baby being born with a small head, that's microcephaly, but not only a small head, but a small brain and developmental retardation, which will have a huge impact on both the family and the community and society.